So trauma is a very complex pathology, not only affecting your physical well-being, but also your psychological. I cover a spectrum of trauma pathologies, beginning from pickup in the pre-hospital environment, specifically my motorsports work, all the way through to post-operative care and follow-up. So a trauma follow-up is undertaken to ensure that every single individual can attain their pre-injury activities of daily living, or the nearest we can possibly get to this given the injuries that they have suffered. The vast majority of trauma injuries can be managed through non-operative measures. However, some individuals may require one or even maybe multiple operations. So how we manage these depends on the specific injury and the physiological status of the patient. And then subsequent follow-up and management depends on what interventions, as well as the initial injury sustained. The whole purpose of undertaking trauma interventions and trauma follow-up is to give the individual the best possible chance of recovery from the injuries they have. It is very difficult to determine at the outset who will have a full recovery. That is why it is vital to have regular follow-up as well as undertaking rehabilitation as required. So this is a huge spectrum of pathologies, and it purely depends on the type of injury and also the patient's physiology at presentation. You could have two identical injuries, but one individual may be able to compensate, whereas the other one does not. So it is a huge spectrum which will be managed on a patient-specific basis.